Hey everybody, this is Robert and welcome to Outbreak News TV. Now Saturday I went ahead and did a report on OutbreakNewsToday.com on the situation in India concerning the COVID-19 outbreak. And it was kind of a milestone article because India became the fourth country to top 500,000 COVID-19 cases. So I wanted to take a little closer look at what's going on in India right now. So let's take a look at globally right now. We did hit a milestone globally too, and I wanted to share that, and that's now at 10 million cases. But if you look down here at the left-hand side, India has reported another 20,000 cases since yesterday, so it's 528,859. And if we take a look at the death toll, it's a little over 16,000. And here are the official numbers from the Ministry of Health and Family Welfare in India. And currently they have over 200,000 active cases. Over 300,000 have been recovered, discharged. The 16,095 deaths. And we'll take a look at some of the cities, and that's kind of really the focus of what I want to talk about today. And here's the list of some of the cities. The states and the cities in India. And we can first start out with Maharashtra. I don't know if I said that right, but they clearly have the most. They have almost 160,000 cases so far, and almost half of the fatalities in India are from this state. This state is the home of the large city of Mumbai. So you got 7,273 fatalities so far. And then of course there's Delhi. Delhi has been increasing at a pretty rapid rate. Also a very large city in India. And they increased by another 3,000 or so over the past 24 hours. So they topped the 80,000 case mark and over 2,500 fatalities. So those are the two big hot spots in India right now, but Delhi is really moving at breakneck speed at this time. Now in this Nature article, they talk about the situation in India, and it says the current surge in infections follows a 2.5-month India-wide lockdown that began on March 25th and severely disrupted the economy and livelihoods. Some researchers say the government failed to take advantage of this time to prepare the country's struggling health infrastructure. Now, even as India struggles, the true scale of the epidemic there may not be apparent. The country has an incomplete death registration system, which means that not all of the deaths are recorded and the documented cause is often incorrect. This raises questions about India's COVID-19 mortality rate, which is officially 11 deaths per million people in the population, among the lowest in the world. By comparison, the UK has seen 635 deaths per million, and the US has seen 376 deaths per million. And I'm going to kill this name, but I'll give it a shot. Jaya Prakash Malili, an epidemiologist at the Christian Medical College in Vellore in the state of Tamil Nadu, has been advising the Indian government on COVID-19 surveillance and helped to design the government's first sero-surveillance survey of 26,400 people to estimate the proportion of the population with viral antibodies. And he did an interview with Nature, and I want to just pick out a couple of the important questions and answers. It says, do you think the outbreak in India is charting a different path from outbreaks in other badly hit countries like the US or Italy or Spain? He says it is. It is spreading much faster here, and the infection rates are higher. The general population's anxiety about the disease is low. People will willingly go out to the market today and take fewer precautions to protect themselves. Consequently, at least in cities, the epidemic is growing very rapidly, and we know it's spreading in rural areas too. The whole trajectory of the infection is moving upwards more sharply than in many other countries. What happened in many Western countries is that when a big city like London was affected, other cities reacted strongly and reduced transmission. So everywhere else, the doubling time got longer, but in some Indian cities, it is short. Excuse me. And that says, India is reporting a mortality rate that is among the lowest in the world. Is that accurate? And the doctor says, the mortality per million people in India is expected to be lower because a low average age of India's population. So we can take some comfort in the fact that the deaths are fewer, especially in the rural population. But the problem with death as an indicator is that COVID-19 death has to be certified as such. The only way to do this is through reverse transcriptase PCR testing, and with a population of 1.3 billion, what do you think is the proportion of people that has access to this kind of testing? It's very low. So it's very difficult to count all the deaths due to COVID-19. There is no way you can get it done unless rapid tests become more widely available. Remember that at least a half of all deaths will happen in rural villages, around 66% of our population, and there are no real mechanisms to ascertain causes of death in these villages. And this is the last Q&A I want to go over. And Nature asked him, what do you think of Indian government's response to the epidemic so far? And the doctor says the lockdown all over the country was not the right response. It brought misery to untold numbers of people and destroyed lives. And we haven't been able to repair its consequences for society. That was unfortunate. If we had planned the lockdown better, we would have still had losses, but they wouldn't have been greater than we were experiencing now. The excuse we had for the lockdown was to gain time. But what we achieved at that time, I don't think is commensurate with the damage from the lockdown. Okay, so let's go on to the next part of this. And we talked about Delhi in the beginning, and they're at 80,000 cases so far, and they've really seen a sharp increase in recent days and weeks. And from this Forbes article, it says, New Delhi reported this is a couple days old now, mind you. New Delhi reported 4,300 cases in one day. To put this into perspective, the entire European Union had recorded about 4,000 daily cases. Total cases and deaths in India's capital are now over 70,000 and 2,300 deaths. Of course, this is a couple days ago, so we know that Delhi is now to 80,000 cases and more than almost 2,600 deaths, surpassing Mumbai, which previously held the title of the nation's worst hit city. Government officials estimate that cases will rise to 500,000 in New Delhi alone by the end of July. And we're going to talk more about that in a couple moments. The easing of social restrictions in the nation of 1.38 billion people has clearly contributed to the rise in infections. But there's another explanation for the tsunami of cases, and that's chronic illness, a known risk factor for COVID-19, and it's no stranger to India. Quote, people of South Asia origin are affected by a high burden of non-communicable diseases such as diabetes and heart disease, explains Bhavna Lal, MD, an internal medicine physician with expertise in global health and public administration. This disease burden is likely contributing to a worsening outcomes to patients in India with COVID-19, close quote. And the real numbers may be much higher. As troubling as the growing number of infections and deaths are, they may not be painting an accurate picture of the scope of the pandemic. According to reports in the Telegraph, the Indian government may be underreporting cases of COVID-19. So that's another concern as well. And let me go to the next article. And this is from CBS News. And they emphasize the situation in Delhi. And let me get the date of this. This article was published 2 days ago. India's jam-packed capital has become the country's hardest hit city amid a raging coronavirus epidemic. Officials in New Delhi have confirmed more than 73,000 cases and blamed at least 2,500 deaths on the disease. Amid fears the outbreak is set to get much worse before it gets better, officials in the capital, home to some 30 million people, more than all of Texas, have been racing to prepare for an expected tidal wave of patients. And we'll go here. It talks about a ballooning outbreak. A third of Delhi's roughly 70,000 coronavirus cases have been recorded in the past week alone. All right, so we're talking nearly 25,000 in a week. And the number has doubled in just 13 days. That's significantly faster spread than the rest of India is seeing. Nationally, the caseload has been doubling approximately every 20 days. The Delhi government's own estimates project more than 500,000 COVID cases in the city by the end of July, requiring more than 150,000 hospital beds for patients suffering significant symptoms. Right now, there's only about 15,000 hospital beds in Delhi. So the government has been scrambling to ramp up its healthcare infrastructure, converting dozens of train cars, hotels, and banquet halls into makeshift hospitals. Okay, and let me go ahead and close out with this, because not everybody agrees with that prediction of 500,000 COVID cases in Delhi. And this is from the Hindustan Times. I believe that's an Indian publication. And it says that, let's look at the headline real quick. Delhi won't have 5.5 lakh COVID-19 cases by July end. And they're saying that those comments were just made to create fear. Now, a lakh is 100,000. So they're talking about 550,000 COVID cases by the end of July. Union Home Minister Amit Shah said he disagrees with the Delhi Deputy Chief Minister Manish Sisodia that the national capital will have 550,000 COVID-19 cases by the end of July. Quote, around the second week of June, Delhi Deputy Chief Minister Manish Sisodia said that by July 31st there will be 5.5 lakh persons infected with the virus. He said that there will be no place left, no beds left, and the situation will be difficult. This has created a lot of fear in the minds of people of Delhi, Shah said in an interview. I do not want to go into whether the estimate was right or wrong, but the situation of fear arose, and some people are starting to mull an exodus out of Delhi, he added. So that's the situation right now. India, and everybody expected that the numbers are probably very, very, very high. And as more testing comes online, we're going to see these numbers continue to shoot up. These massive cities, Mumbai, Delhi, we're talking, 30 million people in a city. These cities are going to be hotbeds, and so it's not a big surprise. We'll be keeping a really close eye on these predictions for Delhi if they're going to have 500,000 cases in the city alone in a month from now. Right now they have 80,000 cases. But yeah, and it's absolutely true. There's, 2/3 of the population of India is in rural areas, and they just don't have access to the complex technology of RT-PCR, and so there may be not a lot of testing going on in some of those areas. So who knows what the real numbers are, but we will be definitely keeping a very close eye on India and other countries that are, Brazil, another hotspot, and we'll continue to keep an eye on the United States, who's getting hit very hard at this moment also. So anyway, I appreciate you watching. Please comment below. I love to hear what you have to say. Any thoughts about India and their situation? How are they handling it? Right? I would love to. How's Modi handling it? Love to hear about it. And subscribe to the channel, share it with your friends, and I'll see you next time on Outbreak News TV.